Well, good morning, everyone, and welcome. Today, we are joined by our friends from Total Benefit Solutions. They're going to talk to you about your 2026 Benefits Jumpstart. Just a little bit of housekeeping before we move forward. If you have any questions, go ahead and type them in the Q&A on the bottom of your screen, and we can ask them live during this webinar. And we are recording this. So if you miss anything, if you want to go back and rewatch it, we will have it up on our website later on today. And we'll also send everyone who registered an email with a link so that you can go back along with the presentation slides too. And I believe they have a flyer to go with this. Yeah, we'll hold off on your questions until the presentation's done. But if you could go ahead and type them in, we can have them ready to go when it's time. And for with that, I think I'm going to go ahead and hand this off to Kylie. She's from our business development department here at the association. Good morning, Kylie.
Good morning and hello, everyone. I'm part of the Washington Hospitality Association. As Lisa said, I help support our healthcare solutions programs. I'm super excited to have you guys all here. We're going to go over what our offerings are, how it can benefit your team, and all that good stuff. If there's any questions at the end, feel free to reach out to me. I'm here to help. And with that, I will turn it over to Tatiana.
Thank you, Kylie. Hello, everyone. Thank you for being here to learn how to make the most of your current or future benefits. If you didn't know, Hospitality Health Insurance Trust, or HI or HHI, has a few nicknames, was formed before I was even born in 1994. And if you believed that, I thank you from the bottom of my lying heart. But yes, it is over 30 years old, and it was created just for people like you, hospitality business owners that care for your employees. KPI. Typically, this means key performance indicators, but I saw this idea and thought it applied here, keeping people interested. Good benefits and knowing how to use them help keep employees interested in staying with your business. Great benefits show that you care, and we do too. Your schedules are unpredictable at times. Your benefits access shouldn't be. We'll show your team how to get care quickly without the scramble. Unused benefits are wasted benefits. Most employers pay into their plans all year without using what's available. Let's fix that. Virtual care lets your team see a doctor without taking time off. No waiting for weeks for an appointment or burning a day off in the urgent care. Virtual care works around their schedule. Your work is physically and mentally demanding. EAP and wellness benefits exist specifically for that. The long hours, the time on your feet, and the high pressure days. A little prep goes a long way. Setting up profiles, reviewing your coverage, and updating beneficiaries takes less than an hour and saves a lot of stress when life gets busy. Benefits are part of total compensation. Understanding their full value helps employees make smarter decisions about their health and their money all year long. What makes Hyde different is that it's designed specifically for hospitality groups headquartered in Washington State. Hospitality covers more than you might think. We're talking restaurants and hotels, sure, but also churches and hair salons, nursing homes, golf clubs, cafes, and a whole lot more. The trust offers a full range of benefits with 2 medical carriers, 2 dental carriers, vision, EAP, life, and Teladoc. And we can set up groups with dual or even triple choice options so that employees have real choices. One thing that really stands out is coverage for part-time employees. A lot of programs leave them out, which is kind of a big deal in an industry that relies so heavily on our part-time staff. Fortunately, through HI, part-time employees can get access to dental, vision, EAP, and Teladoc. One way to be ahead of the game is to set up profiles beforehand. This seems like something I'll just do later until you have 101 fever for the 4th day in a row and you wish that you could see straight to even do it. Teladoc is our telehealth. It's been used by our members in a surprisingly wide range of ways, from dermatology to ear, nose, and throat to urology. And it's for good reason too. When someone has registered ahead of time, as is recommended, our average wait time to have a doctor calling a member is less than 5 minutes. It takes longer than that to get a pen that works at the urgent care check-in. Family members of the employee also get to use the benefit. At $265 per employee per month, that is the epitome of stretching a dollar or two. Teladoc is the gateway to virtual doctor visits, and no one wants to do it when either you or a loved one are sick. So it's worth taking a few minutes to do it now. Start by downloading the Teladoc Health app, entering and confirming your personal information. When you hit the coverage screen, you'll see the High Trust General Medical already selected. That's exactly what you want, so just tap Next to keep going. From there, you add your contact info and create your username and password, and you're in. One quick note on dependents. If you have kids under 18, you'll add them yourself after your account is set up. If you have dependents 18 or over, like a spouse, they'll need to complete these steps on their own. Let me know if you have any questions in the chat. We also have setup flyers in Spanish for a lot of what we're going to go over today. Paying attention to our mental health is more important than ever. I don't think we can deny that. ComPsych offers our Employee Assistance Program, our EAP. Our members are most commonly using the EAP for counseling of all types and legal issues. That's from reporting. Members can get a free legal consult with discounted local representation through ComPsych. Critical incident management is also available with our EAP coverage. This is on-site service to help employees navigate the aftermath of things such as natural disasters, a sudden death or a fatal accident, an act of violence, or any other similar event that impacts the workplace. EAP can also be used by members of the employee's family. For $1.82 PEPM, employees and their dependents each get 6 sessions per issue per year, and there are no cap on the number of issues. So whether you need help raising kids, raising spouses, financial or retirement planning, grief counseling, or something else, EAP is the way to get help at a time that works for your employees' schedules. So please encourage them to utilize this resource. We have flyers that we can send you that you can use in the workplace just to spread awareness if you have this benefit. What's the best way to utilize it? You guessed it, setting up your profile ahead of time. To get set up, just head to guidanceresources.com or download the Guidance Now app. You click register. You fill in the organization web ID, which is HIHIT. That's specific to our trust. And then from there, you create your username and password, verify your email, and then hit submit, and you're all set. Next time when you need it, you just go back in and click in on the login with your credentials. Nice and simple. Life insurance. A little story time for us. Uncle Joe always said Vegas was magical. And sure enough, to his grown kids' dismay, he met Linda at a blackjack table at 9 p.m. and was calling her his wife by 9 a.m. By month 5, the only thing they still had in common was the same divorce finalization date. The moral? Update your beneficiaries because Uncle Joe's life insurance is the only one that acknowledges that marriage ever happened. You can do this very simply. At our Hi website, along with so much more information, we have a form that you download and the employee fills out. The employer, you, keeps the form on file, and in the case that it is ever needed, it would be submitted with the life claim forms. Let's talk about what is available to you with Kaiser when you're a member in the trust. First and foremost, you got it. We're going to encourage you to set up your Kaiser member profile in the app. Only the Washington Kaiser app works. That's this up here in the upper left-hand corner. There is an original Kaiser app, but you need the Washington one. Once set up, you will have access to your ID card, your health records, and you can get real-time care online with a clinician 24/7. One of the options on the previous screen was the consulting nurse with Kaiser. Kaiser's consulting nurse line is great for quick advice, like asking about drug interactions or things like, is this fluttering in my chest actually an emergency or just too much coffee? Or maybe just excited nerves from public speaking. You can call or email. There are more than 60 nurses that work the line and a 24/7 doctor that can prescribe medications. I also like how all the info is stored in one electronic medical record with this. It will be if you go to the doctor at 1 a.m. or if you call the nurse line at 1 a.m. on a Saturday, by the time your doctor comes in on Monday morning, everything is there for them to see. And that is the difference between Teladoc and a nursing service that's available through your provider. Kaiser has partnered up with Calm and Headspace to really take care of us. As long as you start at your login at kp.org or in the app, these are offered at no extra cost. Calm is a meditation app. Meditation is nothing new to most of us. It dates back to possibly 200,000 years ago. What is something new, somewhat, is guided meditation. And if you've never tried that, Calm is the perfect place to start. Headspace is more of an active role in seeking calmness. It has one-on-one coaching and self-care activities that are even available through texting. Something to note here is that Calm can be used by our younger family members, age 13 and older, while Headspace is for 18 and over. On a more physically active program with Kaiser, OnePass is a subscription-based fitness membership program. Starting at $10 a month, you can cancel at any time. There are gym locations, on-demand classes to do on your own, or live stream classes for the community aspect some of us crave. I'd like to note that with any membership, you get 20% off the chiropractor, acupuncture, and massage when using an Optum provider network. High's other medical carrier, Aetna, has a few programs that we wanted to highlight. Again, preparation is key to utilizing the full spectrum of benefits. For the same reasons as with Kaiser, we want to create your profile as soon as you know your member ID. It's quick, I promise. Download the app, hit register, and when it asks for your plan type, choose employer sponsored through work. Then enter your member ID number to verify who you are, create your login, and confirm your email. That's it, you're good to go. Aetna Over-the-Counter Health Solutions, OTCHS. It's a lot of letters. Over-the-Counter Health Solutions. This is an automatic $35 per quarter per member, so that includes dependents. This is specific to CVS, and there is a list of applicable products available. You can also see which products apply in store. To use in the store, the cashier at CVS can locate a participant in the system with the first and last name and date of birth, just like picking up a prescription. You cannot use the self-checkout if purchasing in store, so you do have to use a human. To get started, you just create the account online, and each member must have their own account. Note that the suffix that is on the member ID card matters for this, basically. So that is how they track which person you are purchasing for. So whenever you do create the account online, make sure you plug in those suffixes. Aetna Health Your Way is a digital wellness program. You get custom resources, coaching, and challenges with rewards. To start earning rewards, it's just 3 easy steps. Take the assessment, get personalized feedback, and get going. If you prefer a computer over mobile, you can log in via Aetna.com and in your profile in there, click on Health and Wellness, and then you'll find the Aetna Healthier Way, and you'll be on your way. On both mobile and a computer, any item with a gem icon, this one right here, are the events that earn rewards. Strong and Smart program. This is designed specifically for the hospitality industry. So these are available through your member website login, again, at no additional cost to you or your employees. For the body, Aetna has partnered up with Hinge Health. This is a really intuitive physical training app. You take a survey and you get custom content sent for you to do on your own anytime. As you go through the exercises, it asks for feedback constantly. With that feedback, it adjusts the exercise. For the mind, they have resources that can help you relax, help you sleep, even maybe help you deal with challenging customers, which I know has never happened in the history of history, but just in case. Aetna too has a 24/7 nurse line. It is toll-free and can be used as many times as necessary, and the employees' dependents can use it as well. Members can call to get more information on upcoming medical tests and procedures, such as, do I need to fast for that lab work? Do I need to make sure there's no metal in my waistband? Things that halt these procedures when you show up without planning ahead. You can also send an email from the member website. Let's talk a bit about dental and vision. So the overarching idea here is one way to use your benefits to their fullest is to understand them. We're going to go over a few definitions and ways to use them so that you can answer questions that your employees may have. We're going to start with dental. You've got two carrier options through the trust, Emeritus and Willamette, and they work pretty differently, so it's worth noting the basics. First, a couple of key terms. An annual maximum is simply the most the plan will pay toward covered services in a given year. Once that's used up, the employee picks up the tab until the new plan year. A waiting period is just the amount of time someone has to be on the plan before certain benefits kick in. With Emeritus, annual maximums range from $750 to $3,200, depending on the plan selected, and there's a $50 individual deductible. One nice thing, preventative stuff like cleanings, exams, sealants, fluoride, and x-rays don't count toward that annual max. They are covered at 100%. So your employees can keep up with routine care without eating into their annual maximum benefit. That leaves the higher cost items for the annual maximum. The one thing to flag here is that there is a 12-month wait period on ortho for children. Emeritus has ortho for children, and there's a 12-month wait period for that. Willamette is a whole different model. There are no annual maximums, no deductibles. It's all copay based. They have specific copays for each procedure. And there are no waiting periods on ortho for any age, which can be a big deal for families. Our dental carriers can be offered at the same time with one another, which is different than our medical carriers. So when employees ask which to use, it really comes down to how they use their benefits. If someone expects to need major work or orthodontist soon, Willamette's no maximum, no wait structure could save them a lot. If someone mostly just needs routine care and preventative, either option works well, with Emeritus tending to have slightly lower rates. We did want to point out a brand new plan that we implemented for 2026. It's Plan 8, a $750 annual maximum. That's our most economical and lowest annual maximum. Knowing that all cleanings, exams, and x-rays don't pull from the annual maximum, this plan is excellent for entry-level benefit offering. It's economical while still offering the great 100% coverage on preventative, 80% coverage on tier 2 like fillings and extractions and anesthesia, and 50% coverage on tier 3 such as crowns and onlays. An idea is, considering the fact that you can get this plan for less than $29, you can add in EAP and Teladoc and you're at less than $34 per employee. Add in a great vision plan and you're at $40 PEPM. This can be for full or part-timers. Speaking of vision, Emeritus is the carrier for all of our vision options. What can be a little confusing is that there are actually 3 different networks under that one carrier. So depending on which plan you're on, you might be using the iMed network or the VSP network, or we even have a no network plan where you can see any provider and pay out of pocket and get reimbursed via a claim form. These claim forms are available on our HIVE website in English and Spanish. The important thing to know is that going out of network doesn't mean you have no coverage. It just means that you might pay a little more or have lower benefit levels. It's certainly not an all or nothing thing. Another thing that catches people off guard is if you go in for a routine eye exam, like checking your prescription, that runs through your vision plan. But if the doctor finds something medical during that visit, like signs of glaucoma or diabetes related issues, that part gets billed to your medical plan. So don't be surprised if you get an EOB or explanation of benefits from your medical insurance after an eye appointment. That's exactly how it's supposed to work. Smart consumer strategies. When the world feels like a group chat you just can't leave, at least your health insurance spending doesn't have to be. Let's talk about putting some more control back in your hands. GoodRx is a clear leader of prescription discount cards. The key thing to remember is that GoodRx does not go through your insurance. Sometimes the price beats your copay for the same prescription, so be sure to check every time. There are some other options out there for prescription discount cards, but GoodRx dominates the space. So download the app and give it a try. Price shopping on procedures. The universal tip across all carriers we've talked about is using your member login. You can do this to look up providers and costs too. If you'd rather call, you can call the number on the back of your member ID card before any major service and ask questions like, is this provider in network and what's my estimated cost for this procedure? That one phone call can save you hundreds. The value of preventative care. Checkups, screenings, and cleanings, oh my. Checkups, screenings, and cleanings are all valuable on their own. But what's really incredible is how often they catch something that wasn't even the reason you went in. Your dentist may notice signs of oral cancer during a routine screening. Your eye doctor may flag high blood pressure or early signs of diabetes just from looking at the back of your eye. A routine blood panel at your physical might catch a thyroid issue you had no clue you had. These early catches, have a trifold effect. For members, catching things early means better outcomes and lower out-of-pocket costs. A screening that catches prediabetes is a lot cheaper and less disruptive than managing full-blown diabetes. For you, the employer, healthier employees mean fewer costly claims, less absenteeism, and better productivity. Preventative care keeps the overall risk pool healthier, which helps with renewals. And for the trust, a healthier member population helps keep premiums more stable for everyone long term, and we all want that. This is where you can reach us. Feel free to email this email address right here, hi@tbsmga.com. Our website has a whole host of information. Dedicate some time and learn about HI through there. And that will be the end. We are very open to questions.
Yeah, thank you, Tatiana. I have a question for you. Do I have to wait for a renewal to sign up for EAP or Teladoc or any of the other ancillary programs you described?
You don't. We can add those at any time throughout the year.
Okay. I
Mhm.
have another question while we're waiting. If you guys have any questions in the audience, go ahead and type them into the Q&A at the bottom. We can get those read on air. How many options of dental and vision can I offer at the same time?
Good question. We can do up to 2 dental and 2 vision options. And again, the dental carriers, you can have 1 emeritus and 1 Willamette, or 2 emeritus, 2 Willamette. So up to dual option.
All right.
Mhm.
And we've got a couple more minutes left. I mean, while people are thinking about questions, do you have any final words for us, Tatiana?
I don't. I am something I'm very excited about is the part-time benefits. I have done my research with other trusts, and we seem to be unique in that aspect. So I'm looking forward to. I know things can be kind of hard right now in the industry. So something as low as, $34 a month or $40 a month for to offer such a full range of benefits for part-time employees, I think is could be really valuable and great for morale.
All right. Well, thank you very much. We will have this up on our website later on this afternoon, and we will send out an email with a flyer, a link to this video, and the presentation slides too. So if you want to get in touch with Tatiana or Total Benefit Solutions, that will be there too. And yeah, thank you so much, Tatiana. This was a really
Thank you.
informative webinar.
Thank you.
Yeah,
I hope you all have a great day.
yeah, you too. Bye bye.
Bye.